Hello, Jerome Fryer of Dynamic Disc Designs. I wanted to go over a case in point regarding spinal flexion. And this one was published in the Journal of Orthopedic and Sports Physical Therapy, February 2022. And this was a case report, and the title of it is Flexion Directional Preference. Okay, flexion, right, directional preference in a patient with low back pain utilizing mechanical diagnosis and therapy. So MDT, right, is a program that developed from McKenzie's work. And they are often thought of as an extension-based type of treatment. And I think this case report was to show that McKenzie wasn't all about extension. Interestingly, in the case report, the individual had pain 1 year prior, and he developed an extension preference. So extension actually alleviated his symptoms. So the practitioner advised on a stand-up desk, get the spine more into an extension base, and then he prophylactically began doing extension-based exercises. And he continued on that path for a whole year. Then he presented back to the clinic, and guess what? Yeah, now flexion was favorable. And so I consider this a fail. I understand that they wanted to demonstrate that flexion is helpful in alleviating a patient's symptoms. Okay, well, I think most of us understand that it's not always about extension, it's not always about flexion. You have to be case specific. But there was a fail point with the patient education. There is a period of time that the person should have done these extension-based exercises. Once a patient gets a prescription, there should be an appropriate time frame around how long those extension exercises should be based. So with this case, and it would have been very helpful if the practitioners used a dynamic disc model. If you can show that, now what's best to do is to do extension. If you continue to do extension-based exercises, well, guess what? You're going to be biasing the tissues on the posterior. Very likely, this patient developed symptoms as a result of facetogenic pain. In the publication, they talk about it being derangement. And often when we talk about derangement, you're thinking about disc derangement. But in this case, I'm highly suspicious that it was a facetogenic type of a problem that developed as a result of the patient continuing to do extension-biased exercises because that was the direction of preference. There needs to be a balance. Hyaline cartilage will remodel, sure. And if there was initially symptoms as a result of flexion, okay, extension, but there needs to be an appropriate time frame for the patient to understand. You don't keep doing extension-based exercises until you're in the grave, right? So, with a dynamic disc model, talk about how extension can be favorable for a period of time. Yes. Then you want to get back to the neutrality of the joint. You don't want to bias too far in extension, too far in flexion. So in this case report, I think there was a fail on the education side of things. And I'm sure at a principle, okay, I'm guessing I'm hoping that now that the patient is doing flexion-based type of movements like seated flexion, that there was an appropriate time frame put around that to give the facets a chance to recover. Because guess what? In another year, there's a good chance, if they didn't put a proper time frame around it, that the patient's going to come back and they're going to have an extension preference. Work with the neutral, work with the patient.